right. Well, welcome to another episode of the Rest and Recovery Podcast. With me is Dr. Michael Belkowski. He's the founder and CEO of BioLite, and we will get into BioLite, what they do, and the importance of the technology behind it. So, Dr. Michael, welcome.
Scott, appreciate you having me on.
Yeah, look forward to digging into this. Basically, red light, what this is, and the importance of it. It's just not mood lighting, but there's some medicinal benefit to it. And so how do you go, or really background, what kind of doctor are you? And then how did you evolve into starting BioLite?
Yeah, good question. So the origin story, right?
Yeah.
So I am, my day job is a physical therapist. So I got my doctorate in physical therapy in 2016 from the University of Montana. And I still live in Montana, born and raised. And I got my first job out of PT school, a couple months after at a local outpatient PT clinic. And it really didn't take too long for the, allopathic traditional PT model to not sit right with me for a multitude of reasons. Namely, the way that you treat is dictated by insurances, because if you're a clinic owner, you're going to ask your PTs or whatever type of clinicians you are to kind of treat. You're going to nudge your physicians to treat in a certain way because you're going to get reimbursed more as a clinic. So even if one treatment may work better, but it doesn't get reimbursed, or it's just a lower reimbursement, well, you may be nudged to treat a different way because, again, you're going to get reimbursed more. And as a clinic, you run on foot traffic and you run on money. So I knew that there were a handful of treatments that were quite effective and quite efficacious that I wasn't really as able to use as much as I would like, because, again, I was told or nudged to treat in a certain way. And coincidentally, I took my first certification course after PT school, physical therapy school, in dry needling, which you learn close to nothing about in PT school. But I just thought the concept of sticking people with needles and getting therapeutic benefits was pretty darn cool. So I really didn't know how powerful it actually would be until I took that course. And long story short, I was blown away at how much you can treat, how quickly you get results. And the results are real. They're just not a Band-Aid for the situation.
Okay.
As I'm taking that course, I'm like, how come more people don't know about dry needling? And in a nutshell, dry needling significantly reduces inflammation, improves circulation, so you can really almost instantaneously change people's pain because of those two mechanisms. And that's a key point here in a second when we talk about red light therapy. So taking that course, me with my entrepreneurial mindset, I'm like, why aren't more people using dry needling if it works this well?
Right.
And it's because it works so well that you see people a fraction of the time that you would typically, because it works so well. So if you're an outpatient clinic owner, you're going to see less foot traffic because dry needling works so well. Instead of seeing someone for a month or two, you may see someone 1 or 2 treatment sessions, which is what I do typically with the patients I see with their pain. So I left that clinic, started my own cash-based PT clinic, cash-based because then I'm not dealing with insurances directly. And so then insurances can't dictate how I treat my patients. As long as I'm treating within the scope of practice, I'm not doing anything, outside of the PT scope, then I'm good. And so I opened my own PT practice in Missoula, and I quickly had to kind of be unique with my treatments, but effective and efficacious, because Missoula is just inundated with PT practices. So dry needling was the first one, and then I picked up cupping. Eventually, I picked up blood flow restriction training, and then last year I picked up hyperbaric oxygen therapy. So I guess you could say my treatment approach in general with physical therapy is quite holistic compared to the rest.
Yeah.
And that whole story, while it was kind of long, is important because as I was trying to read and learn about some more effective and efficacious treatments for my patients, I came upon red light therapy, or as I'm reading books and I'm getting them off Amazon, it was suggested to me that I look at this book called Red Light Therapy, and it had tons of reviews and it was 5 stars. And I think it showed up a couple of times before I pulled the trigger, because I'm like, red light therapy, are you kidding me? I'd heard about it on, like the Ben Greenfield podcast multiple times with Juve and all that. And it was interesting when he talked about it, but I didn't really think much of it or like that I would use it. But anyway, got the book, read it, and immediately there was that aha connection, because the book explains the many different mechanisms of how red light therapy works, and namely, it reduces inflammation, improves circulation, just like dry needling. And maybe it's not as instantaneous as dry needling, but it does work when used appropriately. And of course, red light therapy is very safe, non-invasive. You can do it in the comfort of your home. And so as I was reading through the mechanisms of how red light therapy works, and then the second half of the book is basically research on how it helps with skin health and hair health and sleep and thyroid health and athletic performance and fat loss and pain, I was highly intrigued. Again, it was like, if this thing, red light therapy works this well, how come more people don't know about it?
Yeah,
So
that's the question, right?
yeah. And I think still it's very unknown. I mean, it's grown a lot in the last 2, 3, 4 years, but even still, to the layperson, they're not going to know what red light therapy is. And the hope and dream is that eventually it becomes more and more common day, because of what it can accomplish. But again, so I read that book, was blown away, looked at the market, and I thought to myself, well, there's the really cheap products like on Amazon that are probably going to get you cheaper results. Who knows what the safety specs are? And then on the other side of the spectrum, you have very expensive products. Do they justify the price? How are common people going to be able to, invest in this awesome piece of technology? So I saw in my mind that there was this massive gap of, if there was someone that could come in and provide a high quality product for a more affordable price, I felt like the demand could be pretty darn high. And so in early 2019, that's when I kind of pulled the trigger and started BioLight. And okay, it was slow going at first, but really the past, 10 months now or so, it's kind of gone exponential and parabolic, and things have really been starting to take off for my company.
That's awesome. So I appreciate the backstory, because, like our health, it's all building blocks, right? And the other thing is, from a health perspective and as a body, we're a system. So there's going to be different things that complement or kind of complete that sphere of like the health wheel, I'll call it. So with the red light, so what you mentioned a bunch of options. And so how is it that this light is, and not getting too deep, but helping all these different things? Like, how does it help inflammation specifically?
Yeah, that's a good question, because when you start talking about all the different ways that red light therapy can help, it does start to sound like a snake oil pitch. Yeah. But when you understand the science, then it's like, I can see how it can. And that's because red light therapy, red and near infrared light, those two spectra encompass red light therapy. So red is visible. It's that red light that you see. Near infrared is literally invisible to us. It's invisible, but it penetrates deeper. And we'll get into that in a second. But the reason why it works for so many different things is because it positively affects this organelle that's in every single cell in our body, except for red blood cells, and that's the mitochondria. Mm-hmm. People probably heard about this back in science, maybe in elementary or middle school or high school, and it was taught as the powerhouse of the cells. It produces energy. It produces ATP, which is that token of energy. But the research in science the past 5 to 10 years, let's say, has really shown that the mitochondria actually dictate our overall health and longevity, meaning the healthier you can keep your mitochondria, not only potentially the longer you'll live, but the higher quality of life you have, the more vitality you'll have, especially in your later years. And on the flip side, the more dysfunctional your mitochondria are, the more likely you are to come down with some sort of disease or cancer, or you're just going to age quicker. Okay. And that's not even a question anymore. That's thoroughly proven in the research. So if you have mitochondria in every single cell except for red blood cells, and red light therapy affects the mitochondria, then we can start to understand how red light therapy can affect hair health and skin health and the thyroid and all of our organs. And understanding that the mitochondria produce energy, it makes sense that the mitochondria will be most dense in tissues that are energy, that require a lot of energy, such as our brain, muscles, heart, and our eyes. And it's no coincidence that those tissues respond most effectively with the proper dosage to red light therapy. So in a nutshell, that's how you're able to treat the root cause of so many diseases and health and wellness issues is because they really start in the mitochondria. And the top researcher, a mitochondrial researcher in the world, Dr. Doug Wallace, has proven that about 80% of today's modern diseases and health maladies are due to dysfunctional mitochondria.
80%?
80%. And yeah, so again, he's proven that through his science and through other people's research. So that leaves us with 20%, which is potentially genetics or, other things out of, quote unquote, out of our control. But that should be a pretty liberating concept or piece of information, because that tells us 80% of our health and longevity is really within our daily health habits and whatnot. Like, we determine through our epigenetics our overall health and longevity by optimizing the health of the mitochondria.
So we're basically more empowered than
yes,
we're leading to believe. And it sounds like, not to oversimplify, but mitochondria is like, if you're going to pick one thing to focus on, that would be it.
I mean, the more people I talk to and the more people I interview, especially in the biohacking sphere and longevity sphere. And again, I don't want to be myopic. I don't want to say it's the end all be all, because who knows what kind of research is going to come out in the next 5 to 10 years.
Sure.
But with the information we have now, yes, the mitochondria seems to be the foundation and the root of all health maladies and or optimized health.
Yeah. Because I'll tell you, like, I'm a year and a half now doing this roughly, and red light was an early awareness. A friend has a recovery lounge that has a lot of the modalities you mentioned. And always heard the more of the cosmetic side of things, hair and skin. And at first you're thinking, okay, that's more aesthetic. But having healthy skin and hair is also an outward expression, I think, of health as well, that's going on deep inside. Is that a fair statement?
I would think so. Yeah. I mean, you can probably look at people's skin and that tells you how their internals are doing to a certain degree, right? Definitely.
Yeah. So when it comes to building those products and the red light, I mean, does the density of the bulbs or the size of the bulbs or impact, I guess, the prescription or the use case?
Yeah, there's a lot of things to take into consideration. The first one is probably light irradiance, which is kind of a fancy term for light power, meaning how much energy is one LED putting out. So if you're going to invest in a product, you definitely want it to be above 100 milliwatts per centimeter squared. That's the label on it. And if you can get upwards of 125 or even 150, that means you're probably going to get better light penetration, which only matters if you're trying to treat, let's say, the brain or deep in the joints and the bone, where the light has to pass through all those tissues. It has to pass through the skin and the subcutaneous fat, and then other layers of tendons and whatnot. So if your target tissue is like the brain, it has to go through that skull too, or it has to go through that hair.
Right.
So in the end, if you're treating those deep tissues, there's a very small fraction of that light that's actually getting to those tissues. So that's where the higher light irradiance would be important. But if you only really care about, let's say, the superficial skin and tissues that aren't that deep, then that's not as important. But again, you want to have at least 100 as a starting point. To your point, the density of the bulbs, or like how close the bulbs are together, sure, that plays a role, but you also need to know what the lens beam angle is. A lot of people will have, or a lot of companies have it at 60 degrees, which means the light spreads quicker, so you lose the power quicker as well. Okay. The benefit is if you're really close to the panel, you're going to more thoroughly cover your body. But again, if you're stepping further back, let's say if you have a smaller panel and you want to treat a larger portion, so you stand back to allow the light to spread, you're going to lose a lot more of that light irradiance quicker versus a panel that has, like BioLight does, we use 30-degree lens, which means the light is much more focused and more dense, which, I mean, you could argue if you're closer, you're just getting, little dots on your body. But as you stand further back, the light spreads and you don't lose as much light irradiance. So you're still able to cover more of your body without sacrificing light power. So you can go either way with that, depending on what you're trying to treat. But again, those are a couple of things you want to be aware of is the light irradiance. Look into the lens beam angle. And then for safety specs, you want to check out the EMF emission, because there are some companies that use Wi-Fi and Bluetooth, which still perplexes me today, because it's like taking two steps forward, one step back, in the sense you're trying to help promote health with this product. But if the person's close to your device, they're getting inundated with this high EMF. So again, it's like the pros probably, they do outweigh the cons, but again, why include that if you don't need to?
Right.
So check the EMF emission. And if they don't list it, that means they're probably not taking it into consideration, or they don't want to tell you. And then secondly, light flicker, which is kind of a newer safety spec. And I don't believe anyone else is doing this, but BioLite, we were the first one to take this into consideration. And so you want the light flicker as low as possible. And the light flicker is imperceptible to the naked eye, just like our TV screens, our laptops, our cell phones that has very high light flicker, or fluorescent lights. Ask anyone that works in an office, they probably they may get headaches, migraines, fatigued quicker,
blue light
concentration's lower. But it's that high light flicker that our eye does perceive. We don't with our naked eye, but it sends a mixed message to our brain, because we're used to looking at the full spectrum sunlight. If we're talking 100 years ago, or before Edison developed the light bulb, and the full spectrum sunlight doesn't have a flicker. So when we interact with this quote unquote fake light that does have high light flicker, we're sending really confused messages to our brain, which leads to these mood disorders and headaches and migraines and eye strain and lack of concentration. So again,
so like a micro strobe light.
Very, very high flicker. And we're talking like 40 or 60 hertz light flicker, which would be like 40 or 60 flickers per second, if that makes sense, upwards of 100. Okay. And so with our panels, we've gotten it down to about 1 or 2 hertz. And again, you're not going to perceive that, but if you are exposing yourself and your body on a regular basis to your red light therapy device, why expose yourself to more light flicker than you need to? So that's just another safety spec to consider.
So when it comes to the dosing, so to speak, is this like a brush your teeth methodology? Like it's something that you're going to get the most optimal with consistent use?
Yes. And kind of a loaded question in the sense that it depends on what you're trying to treat.
Okay.
If you're doing it for general health and wellness, you feel like you're healthy, but you just going to want to keep your mitochondria optimized, keep your energy levels up there, then yeah, using it on a regular basis is best. But that doesn't mean you have to use it every single day. And that doesn't mean that more is better. And that's something I kind of harp on with my education and in the ebook that I provide, is just like with everything, there's a biphasic dose response, meaning kind of like an inverse or a bell curve, where on the left side of the bell curve, you have dosages that are too low. So if the dosage is too low, again, you're not going to realize those benefits you're going for. But what most people are on when they are using red light therapy is they're on the right side, meaning their dosage is too high, because we get in this mentality that more is better.
Right.
If 10 minutes does this, then 20 minutes must be better. And then if I do 20, well, 30 must be better. And if I'm doing it once a day, well, maybe I should do it twice a day. And so that's thoroughly proven again in the research that more is not better. And you want to get right in the middle, or at least in between on that bell curve, and finding the right dosage, which is actually less than people would think. And the dosage differs depending on what you're treating. So let's say you're treating pain, you would probably do somewhere between 8 to 10 minutes with red and near infrared light, let's say about 6 inches away from the panel, versus skin health. Let's say you're doing anti-aging skin, you would do red light only, closer to 15 to 18 inches away for 2 to 3 minutes.
Okay.
So you can see just between those two examples, the protocol is completely different. So it does behoove people to kind of fine tune the protocols if they're trying to treat, let's say, thyroid health, or if they're trying to treat hair health, or so you get the point that the science is showing that there are different protocols depending on what you're trying to treat. But to your point, I think with just general health and wellness, yeah, semi-consistently using red light therapy, maybe 3 to 4 to 5 times a week on a consistent basis, you will realize some pretty nice benefits.
Okay. So you mentioned thyroid a couple of times as one of the key things. And it seems like, even from my own walk recently, some semblance of hypothyroidism. Thyroid is being discussed a lot, adrenal fatigue, things of that nature. So how does red light impact that as type of challenge?
With the thyroid, well, it's funny. I just interviewed Dr. Carrie Jones yesterday, and
Oh,
the hormone specialist, and she explained to me why adrenal fatigue really isn't a thing. Like the adrenals don't get fatigued. It's just that they send out so much cortisol that eventually the body stops reacting to that cortisol. So it's not that the adrenal is literally fatigued. It's just that this negative feedback loop gets inhibited because your cortisol is just so rampant. Kind of like when you have high blood glucose, you become insulin resistant. So,
okay. Yeah.
but in a nutshell, it really does come down again to the mitochondria. If you have a thyroid problem within that organ, the thyroid, you have dysfunctional mitochondria. So then your organ is not working properly. And I think in the research, it shows that with proper dosages of red light therapy, you can reduce the antibody that's leading to this Hashimoto's or this hypothyroidism. And it's one of the few, if only, treatments, red light therapy, that reverses this hypothyroidism to the point that people can significantly reduce their medications, if not get completely off of them. So
Oh,
it's
wow.
pretty profound, what you can do with light. And again, it's non-invasive, very safe, low risk, high reward. So even with something as staunch and stubborn as, Hashimoto's or hypothyroidism, red light therapy seems to do quite a bit.
Yeah. And the other thing that's fascinating to know. I mean, what's neat about the red light to me as well is you can kind of habit stack other things because it's such I'll call it a passive treatment, it seems like.
Yeah. So a lot of people and myself, you can take that time to also do some breathing exercises or listening to a podcast or book or do meditation, or some people, do yoga, or I have it set up in front of my stationary bike. So whenever I'm on the bike, I get some red light therapy as well to get some augmented benefits there. So yeah, there's a lot of ways to utilize red light therapy as you're doing something else. And like you're saying, to stack it.
Yeah.
Or another way to stack it would be to combine, let's say, cold exposure and red light therapy and then infrared sauna. So, I mean, and or
Right.
hyperbaric. There's a lot of people that use red light therapy, then hyperbaric, and get a nice benefit there.
So maybe explain that a little bit. The hyperbaric is one that I've been turned on to. I haven't used it yet, but definitely a big interest. But when it comes to stacking those elements, like what is that positive bounce?
When stacking those two together,
Yeah, yeah,
well, so I mean, they're completely different treatments. You're getting completely different physiological responses. Red light therapy, like we discussed, is going to reduce inflammation. It's going to cause vasodilation, so you get that improved circulation, optimizing mitochondrial health. Whereas hyperbaric, you are, I'm not an expert by any means in hyperbaric, but my understanding is that you're able to significantly increase the amount of oxygen in your body, not through the red blood cells, because you and me were probably sitting here at an oxygen saturation of anywhere from 96 to 99.
right.
So increasing that by 1% or 2 is not going to do a whole lot. So the powerful benefit of hyperbaric is the pressure infused with the oxygen, whether you're using the ambient oxygen in the air of like 24%, or if you're infusing it with more oxygen, it's the pressure that diffuses the oxygen you're breathing in while you're in the chamber into your plasma. And then once the oxygen is in your plasma, it travels all over your body. So that's how you're able to significantly increase that oxygen level in your body. And plenty of research showing that every time you get in a hyperbaric, you're boosting your immune system. If you have any blockages, I mean, just think about if you had a concussion when you were 3 or 4, or if you had a big injury, like you broke something, or I've had patients where like they got kicked by their horse even when they were a kid. So those type of traumatic injuries causes massive vasoconstriction
Right.
to the point that it's not going to open up on its own necessarily, especially concussions or any sort of head trauma. So even people that have had injuries, again, when they're kids, can jump into hyperbaric when they're in their 30s, 40s, or 50s. And those passages, those vessels that have been vasoconstricted ever since that injury can now be reopened. So now you're opening all of these blocked pathways that have been closed. So you're going to get increased energy. You're going to get increased oxygenation. You're going to get the toxins out, or the garbage out, which
Right.
a lot of people, when they use hyperbaric for the first time, they may get some detox symptoms because, again, they're opening those pathways that have been closed. So by stacking these two type of treatments, hyperbaric and red light therapy or infrared sun and cold exposure, you're just exposing your body to really different types of stresses, hormetic stresses, because that's what light is. It's a hormetic stress, and that's why too much isn't good, but a little bit is great.
Right.
Just like exercise, alcohol. We can go into a lot of different things where the devil's in the dosage. So, but yeah, to your point, stacking these multiple type of health benefits can lead to synergistic results.
Yeah, because like you were saying, they're kind of complementary, like where it seems the HBOT kind of drives it deeper, and then the red light would start to open it up more, and it's just like positive compounding effect.
Yeah, and talking or listening to Dr. Jason Sommers, he's one of the experts in hyperbaric. I think he has some like hyperbaric facilities in New Jersey, I believe. But he was talking about this, I believe it was on a Ben Greenfield podcast a couple of years ago. And this is when I first got into HBOT, that, I mean, he wasn't even really sure which one was more beneficial. Do you do red light therapy first, then HBOT, or do you do HBOT first, then red light therapy? And I forget what he said, what he would do first. I think he said he would do red light therapy first and then hyperbaric. But it's like, as long as you do both, I don't know. And that's something where it's maybe an N=1 experiment where maybe you have to try both, see how your body responds, and then that's what works best for you.
Yeah, that personalized prescriptive approach. Because that's an area that kind of along the lines of the beginning where you were talking about the different modalities and certain constrictions as to how you can be prescriptive. But we're all individual walking chemistry sets, and we're going to respond to the good differently.
Yep.
How do you address that as a PT?
What do you mean? Like, how do I educate my patients on that?
Yeah. Because it seems like it's a big mindset thing because we've been convinced otherwise for so long.
As far as like everyone's supposed to get the same response.
One size fits all mentality.
Well, I think you'd be surprised how knowledgeable the patients are, that they understand that their life circumstances and what they've put their body or mind through is completely different from anyone else. So especially with dry needling, they understand after I educate them that they, based on what they've told me, with that thorough examination and whatnot and their past history, I tell them what I anticipate, but that it's not a guarantee, but this is just based on my experience. This is what I think will happen based on your injury or what you have going on. Same with hyperbaric. This is what the research shows. This is what I think will happen, but nothing's guaranteed, of course, with any of these treatments. And it really just depends on how motivated the patient is, meaning, are they going to do just one treatment and hope for the miracle, like one treatment fix? Or are they going to, are they invested, not financially, but into their improving their health, where they're willing to give it multiple treatments, especially with hyperbaric, because it's like you can use it for athletic performance, or recovery, or post concussion, get in there as soon as you can. It's going to take multiple treatments, and people don't want to realize those stem cell benefits of hyperbaric. It takes 30 to 40 treatments relatively close together to where you're significantly increasing the endogenous production of stem cells, which is pretty darn powerful in itself for repair and growth. But I just tell patients what to expect based on my experience, based on with similar patients. But you'd be surprised that they're not so staunch or expecting the exact results that have been touted, let's say.
So this is the Rest and Recovery podcast. So how does red light support that aspect of the physiology, maybe specifically on sleep?
Yeah, so with sleep, there isn't, let's say, as much research right now, at least, compared to pain or skin, or even thyroid. I think as time goes on, we'll get more and more. But currently, there's research showing that it can help normalize your circadian rhythm, or it can help with melatonin production, and not in the classical way necessarily, because I think most people believe or have learned that our melatonin is produced in our brain, specifically the pineal gland, which is true. But the research shows that melatonin production is actually widespread in multiple organs in our body, including our thyroid, our thymus, spleen, skin, the gut. The point being, with whole body or full body red light therapy or full body light irradiation, you're going to stimulate all those different organs that also complement melatonin production. Thus, that's how red light seems to help, because it would take a laser to get to that pineal gland and really stimulate that melatonin production. You probably get some with it going in your eye,
Right.
but it's getting these other organs, the skin, the thymus, the spleen, whatever, the gut, that's going to help boost that melatonin production. And especially if you're using it more in the evening, maybe not right before bed, because some people get energized by red light therapy. But if you're using red light therapy instead of blue lit technology, let's say watching TV or being on your phone or your tablet, you're replacing that blue lit technology, which increases your cortisol levels, which automatically inhibits your melatonin production. And instead, you're in front of light that is going to potentially stimulate melatonin production, which then is going to reduce cortisol levels, which is going to allow you to go to sleep quicker and get into that deep sleep much more effectively.
Yeah. And ultimately, I guess as a eventual byproduct, you're kind of circulating the brain, and then it'll clear out and allow the lymphatic system and your glymphatic system to kind of do what it needs to do.
Yep, exactly. It helps with all those processes.
Well, from a red light perspective, who can benefit from this?
I guess I would say who can't. And I'm not saying that as an owner, but it's objectively, again, going back to the premise and the reason why red light therapy works, as far as optimizing the mitochondria being the big one, and reducing inflammation, or modulating inflammation, I should say. Who couldn't or who wouldn't want to do that, given the research that we have now? Again, back to Dr. Doug Wallace, the more energy our cells have, the more functional our mitochondria are, the less disease you're going to accrue, especially as you get older and older and older. So if your goal is for health and longevity, then it would behoove you to optimize your mitochondria. And that doesn't mean you need a device. You can get red light and near infrared light by going out in the morning when the sun rises, because that's where there's a higher proportion of red and near infrared light. And then as the sun sets, same thing. So those are two ways to get free red and near infrared light. So if you do that on a consistent basis, not only are you going to be getting that red light, but that's going to be normalizing circadian rhythm, because you're going to be out there when the sun rises and the sun sets.
Right.
But again, to answer your question directly, it's like, if you're into health and wellness, longevity, optimizing your mitochondria is the way to go.
Yeah. And kind of to your point, I don't know who wouldn't want to feel better
right,
every day, especially as we age. And, I'm not as young as I used to be. But I have kids, and I want to be there and be able to be there for my grandkids or great grandkids.
And that's another thing with red light therapy, is the healthier you are, the less you're going to notice with red light therapy, as should make sense, but maybe wouldn't be as apparent. Because if your mitochondria are already optimized, and if your inflammation isn't chronic and rampant, and again, you've got good circulation around your body, you're not going to notice like this, aha, wow, red light therapy is amazing, because you're already healthy. The proof in the pudding is going to be as you consistently use it, week in, week out, month in, month out, and over time, comparing yourself, I guess, to your counterparts or to your colleagues who don't use this type of technology, you're going to notice that you're feeling a lot more vibrant and have a lot more vitality, and you're just looking healthier, feeling healthier. So that's where you'll notice the difference if you're already kind of optimizing your health. Whereas someone who's got osteoarthritis, or they've got a lot of pain because they have systemic inflammation, or they're dealing with, let's say, thyroid health or an organ issue, they're going to notice results a lot quicker, and it's going to be a lot more obvious because there's more room for improvement. So that's another reason why that people may not see the results that have been touted by red light therapy. Again, back to the overdose or the biphasic dose response principle, where people may be doing too much light, but also if they're doing the correct amount of dosage, their health may just be that well off that they're not going to see these massive, amazing improvements that have been purported, in the red light therapy industry.
That's a fair point on, kind of expectation setting. And I guess that goes back to kind of understanding yourself and your own physiology. What's the best methods to kind of help support that context? Are there tests like blood tests, UAs, or things of that nature that kind of determine your mitochondrial health in advance to know if red light is
question? As far as mitochondrial health specifically, I don't know if that's if there's a test for that. That's a good question. I'm sure there will be if there hasn't been already to test whether it's mitochondrial vitality or health, shall we say. Also, mitochondrial density, because the more dense it is, the healthier you are. Because as you get older and you have more and more dysfunctional mitochondria, those get just like autophagy. There's mitophagy, where dysfunctional mitochondria get eaten up or disposed of. But when you have too many dysfunctional mitochondria, that doesn't happen. And that's where you start to see dysfunctional mitochondria replicated or copied. And that's really where the disease and aging process comes in, is when you have too many dysfunctional mitochondria, those dysfunctional mitochondria get copied, and so on and so forth. So to your point, if there was a test that could find not only the health of the mitochondria, but then the density and the quality, that would be a test we could, or that I would look forward to. But otherwise, yeah, you could look at some blood tests that would look at inflammation markers, or if you have like an Oura ring or some sort of biometric marker, you can see how your sleep, your sleep and like your readiness score, if you're using Oura ring, how that changes with consistent use of red light therapy. So there's some things like that, or just objective, how do you feel, which some people are more in tune with their body than others, but that may be the most accurate. I did this treatment, how do I feel? Or I've been doing this treatment for 2 or 3 weeks. What do I notice that's different before I started it? But to your point, I'd be excited to see a mitochondria specific test at some point.
Yeah, I just was thinking about that. Just so right, what you're saying, if I'm oversimplifying, hopefully I catch it. It's really understanding mitochondrial health would be subjective a little bit and expressed. So through your actions, through your ability to sustain energy and things of that nature and do all the things and wake up refreshed, yep, you're probably in a good balanced state.
Exactly. When you wake up, how long does it take for you to feel energized? Does it take you 10, 20, 30 minutes, or does it take you 2 or 3 hours and 3 cups of coffee? Right. And then the other side of the circadian rhythm, how quickly can you fall asleep without melatonin or without CBD oil? Not necessarily that's a bad thing, but again, using your endogenous physiology, again, how quickly do you wake up energized? How quickly can you fall asleep and get into that deep sleep?
Yeah, and that's a great point. Even personally pondered, like, it's great to have some of these naturopathic methods of, melatonin and things, but then it's kind of like, well, my baseline is kind of low and I'm becoming dependent on this. Why is that? And how do I kind of push the line north so that I'm not as dependent on it? And it's more like just the occasional rather than habit creation.
Right. And melatonin's kind of a tough one. I don't want to knock it at all, because I was reminded when I interviewed Dr. Tyler Jean, who's a naturopathic doctor, that there's the anti-inflammatory, antioxidant, anti-tumor, anti-cancer properties of melatonin. So melatonin's not like this bad thing. And right. I asked him when he was in naturopathic school, what did you learn about it? Is it a bad thing to take consistently because with the worry that you may ruin your endogenous production? And his answer was they were learned both, and there was no definitive answer. So again, I guess I don't know because he wasn't taught in naturopathic school. Does taking it consistently wreck your endogenous production, or do the benefits that I talked about, the anti-inflammatory and so on of melatonin, does that make up for it? And is it worth just taking on a consistent basis with those facts alone? Yeah. Again, we need some more research to be definitive about that. So I think you could argue either way.
Yeah. And here's the thing, I think a little bit, depending on what you're using, right? Because there are certain pharmaceuticals that are going to have those unintended consequences, kind of like you were saying with the EMF, right? You're taking 2 steps forward and 1 step back because there's some unintended consequence. But if some of this doesn't have a negative effect, well, it's going to be better than not taking it and feeling horrible all the time, because you're never going to have peak performance or just being able to serve in the way you want to serve in your life and the vision you have for being a parent or a friend or spouse or what have you.
Exactly. And as you well know, and your audience well knows, sleep is massively important. So much happens when you're sleeping, when you're getting proper circadian rhythms between, growth and repair, especially with the nervous system. So if you're missing out on that on a consistent basis, that's just a domino effect for every other health aspect in your life. And like you're saying, if your purpose is to serve and bring as much value to this world as possible, it behooves you to optimize your circadian rhythm, optimize your rest and recovery so that you're able to do that at your highest level on a consistent basis.
Yeah, 100%. And I think that's at the end of the day, that's kind of purpose, right? We're communal, we're relational people. So being able to do that better is a heck of a lot more fun too.
Yeah, agreed.
Well, Michael, we've been chatting for a minute. I appreciate your time. I do like to close with a few personal questions, nothing too deep, but what are you reading right now?
Well, I always read like 3 or 4 books at the same time, which I don't know if that's productive or not, but they're quite different. I forget the name of it because it's such a long name, but it's a small research book that has to do with how light affects your eyes and your metabolism, and it's back from like the 1950s by Fritz Hollowich. Is amazing. I'm literally gonna do a podcast episode on that book, because the implications of light and how it affects every process, your hormones, your energy. It's amazing. And so I'm reading that book. Regenerate by Sire G. Another book called Ask and It Is Given. That's more of like a personal growth book. And then, well, I think those are the big 3 right now.
Okay.
And then I'm always digging through the photobiomodulation research. So I guess you could call that reading.
Well, real quick, photobiomodulation. Is that like the science term of red light?
Exactly. Photobiomodulation. So like photo, light, biology, modulating, changing. So changing your biology with light.
Okay. What are you listening to right now, be it music or podcast?
Music, man. Well, podcast, it's always been Ben Greenfield. I don't listen to many others. And I even go through ebbs and flows if I even listen to podcasts or not. Sometimes I just crush them, and sometimes I'll go a month or 2 without them. But
Sure.
Typically it's Ben Greenfield. And then music, I'm kind of into like Kygo and Chainsmokers. But in the morning when I'm hanging out with my puppy or making coffee and doing my reading, I'll be listening to Beethoven and Bach and Mozart and Vivaldi, because I grew up as a classical violin player. So that's
okay.
So I feel like that's a good way to wake up. And then when I need to work, I listen to my pump up music, if you will.
Yeah, maybe a little Metallic in there for the get ready.
There you go. As a hockey player, that was playing in the locker rooms all the time.
I'm sure it was. Last one, but what is your go-to rest and recovery method?
Well, it's not one. It's just my daily habits. And so when I wake up in the morning, I go outside barefoot. So I'm either standing or cross-legged on the ground watching the sunrise with my puppy. So I do that for anywhere from 10 to 30 minutes. So that helps just wake me up, normalize my circadian rhythm. In the winter, I'll be using a sauna that I have, a barrel sauna outside my house here. In the summer, it's not as appetizing. Then, from fall through spring, I'll get out. I live right close to a river, so I'll get out, do some cold plunges. When I first started, it was close 10 to 15 seconds, but now I can do several minutes up to my neck in this ice cold river.
Oh, wow.
I'll implement that. Then, of course, red light therapy, depending on what's going on. I haven't really needed to treat any health conditions or very few aches and pains, but I just do it regularly on a consistent basis, much more in the winter because here in Montana, it's gloomy, whereas in the summer, I get my sunlight from the full spectrum sun. So I utilize those, and then my hyperbaric chamber, which I have in my home office here, so I have access to that. I'll do that anywhere from 2 to 4 times a week, like 60 or 90-minute sessions.
Nice.
I have my diet pretty fine-tuned. I do intermittent fasting. Sometimes I'll do a 1 or 2 day water fast. So yeah, stuff like that. And then one that I've been working on the most the past year or 2 has been kind of that meditation or mindfulness, or just getting more into my inner light, if you will. So that's probably the one that needs the most work and the most consistency. But it really has made a difference. And I do appreciate the changes I've noticed really in a short period of time by digging into meditation and mindfulness practice or gratitude practice.
Awesome. Well, it sounds like you definitely have a full stack. of options and variations. Yeah,
Yeah.
I mean, the mindset piece is newer to me. I know for a long time it was kind of my mindset around mindset was kind of like, oh, this is hokey.
Yeah.
But there's a lot to be said with, that affirmation conversation with yourself and the ability to just kind of, turn off the engine. It's almost like, we leave the car not running in place, but like a light is on internally. If we don't manage that, we're going to drain ourselves. And the mental aspect has a lot to do that.
Well, and especially being an entrepreneur, it's like you're always on the go, go, go. You can't ever turn it off because there's always something to do or 10 things to do. So being able to, yeah, literally, just set some time aside, quiet your mind. And it's incredible, whether it's research or, belief from all these different experts. If you can connect with the quantum field, which is still tough for my mind to wrap around, or if you're able to send out these positive vibrations or positive energy, what that does. So you're always sending out energy from your mind, from your thoughts constantly, and they can either be positive or negative, and you're going to get what you send out in return. So flipping your mindset, because again, being an entrepreneur, you're always on the grind, and it's easy to get in this perseverative negative mindset, which just feeds upon itself. So why not flip the script and have that positive mindset and let that be your new wheel of motion, if you will, in your mind. And it's amazing what you can manifest and what comes simply from that change.
Yeah, it's that simple principle of you reap what you sow. And I don't think I've ever really thought about it from a mindset perspective. You always think about it from, or at least I have, from a doing, right? An activity. Well, it could be your conversation, especially the one with yourself, because you can't get away from it. So,
agreed.
Well, Dr. Michael, I appreciate your time, expertise, and look forward to meeting you out in the Biohacking Congress in October.
Yeah, that's going to be a fun one. My company BioLight's a platinum sponsor. And so with that, I'll be giving a 40-minute presentation on red light therapy. So I hope that I'll be able to bring some newer cutting edge information and also, just some classic information on red light therapy to help people learn about it and expose the potential if people aren't using it already.
Yeah, that's awesome. And real quick, how can folks find you?
Yeah, so my company is biolight.shop. That's .shop. That's both the website and the Instagram handle. If you want to reach out to me, email or direct message through Instagram works, but also email, which is info@biolight.shop. And I'm pretty responsive, happy to answer questions. And that's one of my missions with BioLight is, not just to be a capitalist and sell stuff, but I am genuinely energized by helping people understand and by educating. So that's one of my main missions with BioLight is just to help educate. Whether you buy my product or not, that's not necessarily the main point. It's educating people on the power of red light therapy and kind of opening their mind to, like you and I have been talking about, being your own best advocate with your health, taking health into your own hands. And red light therapy can be one of those things that could probably help you along your health journey.
Yeah, awesome. I appreciate the mission, and thank you again for joining me.
My pleasure, Scott. Thanks for having me on.
Take care.